Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, my name is Mumtaz Abdurrahman, and I am a student of the Faculty Dentistry, Sultan Agung Islam Semarang University, or Unisula. Today I would like to present a journal review or identify scientific research journal, and this presentation is conducted to fulfill the requirement of the final semester examination. So, this is the task. Identify scientific research proposal for some aspects as follows. Number one, what are the subject and object of the research in this journal? Number two, what is or are the objectives and hypotheses of the journal? Number three, what is or are the research questions of the journal? Number four, list some theoretical frameworks which were used in the journal. Number five, what research method or design which was used in the journal. Number six, what research instruments which was or were used in the journal. And number seven, what is or are the results of the conducted research in the journal. So, this is the journal identity. The title of this journal is Early Life Professionals and Layperson Support Reduce Poor Oral Hygiene Habits in Toddlers, a prospective birth cohort study. This article was published in 2018 in the Dentistry Journal, an international peer-reviewed open-access journal published by MDPI. The study was conducted by Deep Hong Ha and Lok Kyang Do from the Australian Research Centre for Population Oral Health, University of Adelaide. The background of this study is based on the high prevalence of early childhood caries, which is closely related to oral hygiene behaviors established during early childhood. Since toddlers are highly dependent on their parents, particularly mothers, parental knowledge and support play an important role in shaping children's oral health behaviors. The aim of the study was to evaluate the effect of early dental visits or for oral health advice and the availability of layperson support on unfavorable oral hygiene behaviors in toddlers aged 24 to 30 months. This research used a prospective population-based birth cohort design. The data were obtained from the SMILE, or a study of mothers and infant life events affecting oral health, study conducted in South Australia. Data were collected using structured questionnaires administered to mothers from birth until the child reached 24 months of age. And the first question is, what are the subject and object of this research in this journal? So the subject of the research were mothers and their children, or mother-child diets, who participated in the SMILE, or study of mothers and infant life events affecting oral health, birth cohort study in South Australia. Specifically, the study focused on mothers of toddlers aged 24 till 30 months. And the object of the research were early life oral health behavior toddlers, particularly unfavorable practice such as putting a child to bed with a bottle and not brushing the child's teeth before bedtime, as well as the influence of early professional dental advice and layperson support on those behaviors. And the second question is, what is or are the objectives and hypotheses of the journal? So the objective of the study was to evaluate whether early life visits for dental checkups and oral health advice, as well as the availability of layperson support to mothers during the first 2 years of a child's life, were associated with improved oral health behaviors in toddlers. And the hypothesis was that early life socioeconomic and background factors influence exposure to professional dental advice and lay support, which in turn affect unfavorable oral health behaviors when children reach 24 till 30 months of age. So the third question is, what is or are the research questions of the journal? So there are three questions of this research question of the journal. Number one, does early dental visiting for oral health advice reduce unfavorable oral hygiene behaviors in toddlers? And number two, does the availability of layperson support for mothers during early life improve oral health behavior practice, practice for their children? Number three, how do socioeconomic and maternal background factors influence this association? Next question is, list some theoretical frameworks which were used in the journal. So there are three theoretical frameworks. Number one, the common risk factor approach, which views oral health behaviors as influenced by shared social and environmental determinants. Number two, a life course approach, emphasizing that early life exposures shape health behaviors later in childhood. And number three, the social determinants of health framework, focusing on how socioeconomic status, education, and social support affect health behaviors. The next question is, what research method or design which was used in the journal? So the study employed a prospective population-based birth cohort design. Data were collected longitudinally from birth until the children reached 24 till 30 months of age, allowing the researchers to examine temporal relationships between early exposure and later oral health behaviors. Data were collected from the SMILE prospective birth cohort study using structured questionnaires administered to mothers at birth and during follow-up when the children were aged 3, 6, 12, and 24 months. The questionnaire gathered information on socioeconomic factors, early dental visits, layperson support, and oral health behavior practice for their children. Data analysis, data analysis was conducted use descriptive statistic, bivariate analysis, and multivariable regression models with a log Poisson link, and robust error estimation to calculate adjusted prevalence ratio and 95% confidence interval while controlling for potential confound. confounders. Statistical analysis were performed use SAS version 9.4. And the next question is, what research instrument which was or were used in the journal? So the primary research instrument were structured parental questionnaire administered at multiple time points. This questionnaire collected data on socioeconomic characteristics, dental visiting patterns, disability support, and mothers report oral health behaviors practice for their children. So the last question is, what is or are the results of the conducted research in the journal? The study found that a substantial proportion of mothers practice unfavorable oral health behaviors. Multivariable regression analysis show that children who did not receive early dental advice had significantly higher rates of bringing food to bed with a bottle and not having their teeth brushed before bedtime. Lack of layperson support was also associated with higher prevalence of these unfavorable behaviors. The findings confirm that early professional dental advice and social support play an important role in establishing healthy oral hygiene habits in toddlers. So, in conclusion, this study demonstrates that early dental visit and adequate support for mothers play an important role in preventing poor oral hygiene behavior in toddlers. Early professional Early professional guidance helps parents develop proper oral health practice, while layperson support strengthens strengthens their ability to maintain these behaviors at home. These findings emphasize the importance of preventive dentistry and early intervention in reducing the risk of early childhood caries. For dental professionals, the study highlight the need to actively participate in oral health education for parents from an early stage. So that's all from me. Thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh.